Thank you for coming to this session, which will focus on the role of creativity in equity research and the relationship, as I understand it and experience it, between creativity and equity. I'm going to share some thoughts about how and why creative approaches can be used by us in our research to both support a wider range of participation by a wider range of people, but also to enable the intended audience to hear better the messages and findings within our work. I'm going to share with you some examples from research and clinical work that I've been involved in, which have led me to understand this relationship more deeply. The presentation was going to have a kind of reflective and reflexive feel, and will be something of a kind of meander through some of my clinical and research practice over the last few years in the UK. But first, I want to explain a bit about my roles. So where I'm coming from as a clinician and as a researcher, and think about the identity of the art psychotherapist researcher. So I'm a clinical academic art psychotherapist at a large urban mental health trust in the UK, in Birmingham, right in the centre of the country. My clinical work is mainly with adults with enduring mental illnesses, most of whom who also have complex physical health conditions and experience multiple health and social inequalities. I have a background also in palliative and hospice care, and as a researcher I've been interested in the end-of-life and palliative care needs of people with mental illnesses for many years, and this has then developed into a wider interest in health inequalities, particularly around death and dying. I have a couple of roles in addition, so I'm an honorary clinical professor at the University of Birmingham and a co-founder of the No Barriers Here project, which I'll talk about a little bit later on in the presentation. So my broader research work focuses on using arts-based research methods to understand and address health inequities, and I'm particularly interested in the relationship between mental and physical health. Prior to being an art psychotherapist, I worked in a range of health and social care settings and always seemed to find myself in services or in teams where we were working with very underserved and excluded people, and that's really gone on to kind of shape the work that I do. And I want to explain a little bit about the profession of art psychotherapy, because it's often subject to a myth and misunderstanding, and also it's kind of held differently in different countries and different parts of the world. So in the UK, art, music and drama therapists are the only 3 state registered and regulated psychotherapies. So we're regulated by the Health and Care Professions Council, and our titles are legally protected. So we form 3 of the 14 allied health professions here, and we're also part of the psychological professions framework. Art psychotherapy can be thought of within a triangular relationship. So we provide less verbal psychological therapies. It's relational and psychodynamic in its origins, but in its modern presentation adopts a much more integrative approach. We've seen particularly a focus on understandings of neuroscience, of compassion-focused therapy, and of more body-based methods such as sensory motor therapy and mentalization, kind of influencing modern art psychotherapy practice here in the UK. Art making in its broadest sense forms part of this triangular relationship, which includes the therapist and the therapy, which is a term that's quite new to me, therapy, but it came from a service user. So we would say service user or patient, and this person said that they felt that therapy was a more collaborative way of describing the patient. So something that I've recently adopted into my dialogue. So when we think about art making within that triangular relationship, it can be used in several ways. So it can be used to regulate emotion. It can be also used to explore and to express emotion. And art psychotherapists are concerned as much with the process as the end product. So we're not there to teach art or to create works of art to put up on the walls. It's more about using art making and creativity to have different types of conversations. And we've seen access to less verbal therapies becoming more and more important as we understand the range and the diversity of people who need a less verbal approach. So traditionally, we've well understood that some people might struggle to communicate verbally, maybe as a result of illness or disability or language difference. but I think in recent years we've gained a much greater understanding of the impact of trauma, for example, on the body, of different neurodiversities, and also of experiences of prejudice and discrimination. And that leaves many people struggling to connect feelings and thoughts, the mind and the body, and to communicate. And so while excuse me, the evidence base for talking therapies is really well established and they offer benefits for many, many people, we also know that they're not accessible for some. And so access to less verbal therapies has become increasingly important as an equity issue. And all of this also applies to research participation and the improvement and the innovation work that we're all involved in. So if we only offer verbal and written forms of participation like interviews and surveys and focus groups, we're going to exclude many, many people from taking part in research. So as a researcher and as an art psychotherapist, my work focuses, as I said at the start, on the use of arts-based methods to understand and express experiences. So our clinical training as art therapists supports our work as researchers, and I'm coming to believe that actually art therapists with research training are really valuable assets to equity-focused research teams. So what is the relationship between creativity and equity? Well, creativity is an innate human experience, and nobody has ever been able to tell me a time or a place in human history where we haven't expressed ourselves creatively. And that might not be with oil paint or Sharpies on canvas and paper, but it might be through dance or poetry, song, music, through decorative, symbolic artifacts, cave paintings, storytelling. Humans inherently want to create and to communicate. I mean, many of you might also be doodling while you're listening to me. And we use creativity in lots of ways to distract ourselves, to relax. Those of you who knit will be very familiar with that kind of getting into that state of flow where you're knitting, doodling, drawing, colouring in to kind of regulate and steady your and sort of still your minds. But we also use it to explore and to communicate and to protest and to persuade and to educate. Art making has many, many different functions. But if I were to ask you who is good at art, most people will look quite shifty at this point. One or two people sometimes put up their hands. When we run our workshops, almost nobody says yes. Even those who are probably quite good worry about what will happen if they say yes. If I then ask, well, who's creative? Usually a few more hands go up. So what happens to us? Why do we not feel in contact with our own creativity? If what I've said is true, that it's an innate human thing, what happens? What gets in the way of us feeling kind of creative and artistically able? Well, for many people, the education system has caused huge feelings of shame. From an early age, it pits people against each other, and it categorises who's good at art and who's not, and whose artwork never goes up on the wall, who can sing, who can't. And it also plays out in our families, and those of you with children will be, I'm sure, familiar with being presented with endless paintings at the school gates and saying, what's that? Or that's good. But how different is the question, well, wow, that's really interesting. Can you tell me about it? We don't intend to perpetuate feelings of shame, but often we do so unconsciously, and we just kind of pass it on really from sort of generation to generation. And even when we're praising somebody's work, and we see this a lot, somebody in a room, in a group particularly, says, that's really good. Everybody else reads something into that their work isn't so good. We kind of leave people wondering about their own work. And so this might sound like a warning against using creativity or art making, but actually, on the contrary, it's something to bear in mind. But when we use art making and creativity safely, creative approaches to clinical work and research work can create really wonderful spaces of recovery for patients and participants. So bringing this back to our research work, and that's something that's kind of bringing us all here together today. Why is this relevant when we think about equity-orientated work? Well, if we can harness this creative ability and to use less verbal methods in our work, several things can happen. So firstly, we open up participation to a much wider group of people. There's lots of research kind of emerging now about the profile and the range of people who take part in research and the kind of privilege often that is associated with research participants. And there's a greater need. I'm sure you've got work in Canada. We certainly have it in the UK, work that's emerging that talks in depth about how we need to engage a more representative group of people in research activity and what some of the challenges are around that. And there's a role for art making and creative methods in broadening participation. The second thing that happens is that we slow down the process of gathering data. So if we think about an interview, we may have all sat in them as participants as well as researchers. We sit down face to face, we have a list of pre-prepared questions that we put through ethics or whatever. We're going to ask them to a participant who more often than not hasn't seen the questions. And often in university settings and in healthcare, we do this in rooms that we've decided help people feel safe. So small, quiet, private rooms, often down a corridor. And for some people, particularly many of the people I work with in the mental health trust, this is not safe. Being taken away down a corridor with a stranger to a small space it's not a great place. It doesn't feel safe, and it doesn't allow time either to think or to feel or to explore the answers to the questions that many people have never been asked before. And particularly when we're thinking about people that are underserved, being asked opinions and questions will be even more unusual for those people. And so that whole experience can be really triggering and difficult. Creative approaches often happen in non-traditional spaces, which can disrupt this dynamic. Traditional approaches to gathering data can heighten anxiety, they can put people on the spot, and they can lead to answering questions incompletely or a very surface level, which can feel really inauthentic, and it plays into traditional power dynamics between the researcher or the clinician and the participant or patient. Creative approaches can really successfully disrupt these dynamics and support a greater authenticity and depth of participation. So I wanted to share some examples of where creativity has been inherent in the design of clinical interventions and research projects which address inequities. So first of all, a clinical example. So as an art therapy service, we deliver all our therapies indoors in traditional NHS spaces. They're slightly less traditional because they're art rooms, or they're rooms with art materials in them, but on the whole they feel fairly clinical. In our service, we tend to reach far more women than men, so many more women are willing to attend and access psychological therapies than men, broadly speaking. We reach far more white people than people of colour, and we reach far fewer younger people. We have lots of people referred to us who are lonely and isolated, for whom that loneliness and isolation is exacerbating their mental health. But they're fearful of coming to groups. We also get referred lots of people who've kind of found other therapies unhelpful, so they might have had kind of failed attempts at psychological therapy because those therapies haven't been right for them. And we have lots of people referred to art therapy who have coexisting physical health problems. So kind of in the run-up to the pandemic, and actually even more so after the pandemic, I wanted to create an outdoor group. We know the benefits of being with nature and of moving more in moving our bodies more and being in relation to other people. So we know those three things help us as humans to be well, but we needed a different approach to the delivery of our service. So we set up a group called Outside Alongside, and rather than being diagnosis led, so again historically we've run groups for people with X, Y or Z condition. We wanted to offer this as a kind of an offer to a certain type of person, not a person diagnosed with a particular diagnosis, partly because diagnosis is really problematic and it's not fixed and it changes. So we set up this group, and the idea of it is to combine less verbal therapy, the benefits of a less verbal therapy, with the benefits of working outside in a natural setting. And the way we advertised it was This is suitable for people who find being in a group difficult but feel isolated, find being in a traditional clinical space difficult, for people who might benefit from being outside and being more active, and for people who might be interested in how being outside and being creative improves mental well-being. So we kept it kind of broad and general, and we invited people to come and join us in an outside space, which you can see in the photograph at the middle there, in the grounds of a big training building that we have, so a big old Victorian building with lovely grounds that prior to this group only really staff used that building, and so it felt like we should be offering something to our service users. So the focus in the group and the kind of things that get made you can see here on the screen. So we use natural materials, we kind of explore shared themes both individually and as a group. So there's space in the group for people to go off on their own and to move physically away from each other and then come back together. It's been one of the key things really is it's been co-developed, so that the sort of nature of the intervention, if you like, has come from the participants, and creating large-scale outdoor artwork as a group is something that early participants really valued. So you can see the piece in the top left. It's an enormous rectangle made of leaves and sticks. It's something that the early participants really valued, and they talked about how they'd never really had a positive experience of working in a team or in a group, and that was at school or at work, and that actually in this group creating and interacting together has been a really positive and a different way of being together. The outdoors offers lots of metaphors for change, for coping with the unexpected. The weather in England particularly offers us lots of chance to have to adapt and be flexible. The cycle of nature gives us endless sort of metaphors and symbols around working with loss and uncertainty. So you can see on the screen here on the right, there's a kind of a frame that somebody's made. So it's an activity where people create a frame and then we look through it at different angles. So this view, you can see a large, enormous tree. If you were to move and look back, what you'd see is a kind of human-made building and kind of industrial Victorian era kind of building. And just talking about looking at things from different perspectives has been a real kind of eye-opener for people. The weather is a great leveler. So, when the participants get wet, we get wet. When it's cold, we're all cold. And then using natural materials rather than art materials is also a leveler of power dynamics. So it allows people to move towards using metaphor and symbol rather than focusing on kind of likenesses and realism and who can and can't draw. And what we've seen is that these groups have increased participation in psychological therapy across ages. We've had more men attending, and we've had more people from diverse ethnic backgrounds taking part. And more than the sort of social demographics in some ways, this group has opened up psychological therapy also for people who find traditional indoor spaces and talking therapies traumatizing, triggering, inaccessible. So it's addressing inequity on multiple levels. So I want to move on now and just talk about some examples from sort of research practice. So Life Moving was a collaboration between a film theorist, so a sort of traditional film academic, a filmmaker, and a hospice where I was working at the time as an art therapist. And we wanted to make films that disrupted the traditional sort of sad hands palliative care films. I'm sure you know them. Or the kind of heart-wrenching films that are designed to make you donate money, because they're very successfully used for those sorts of purposes. But we wanted to think, and particularly the academic wanted to think about how film could be used in a more ethical frame. And so we made a filmmaker accessible to participants so that they could use her skill set to create their own films. And 6 people took part, and they made 6 very, very different films. Some in the sort of more polished documentary style, some were more kind of rough and ready. One of them was a slideshow of photographs of one man's travels around the world. It was more like a kind of a legacy film. So each person approached it in their own way and made once we had to really give up control. I think there's a sense of wanting the films to look a particular way, or if you've got the skill set to make highly polished films, letting go of that kind of desire to control was really important for all of us, actually, that were involved as researchers and as other roles in the team. And so we created these films, and they absolutely sort of allowed those people to sort of tell their stories. If we had more time today, I would show you some of the films, but I've put the links in so that you can have a look, because the films are available on our website. And then we wrote 2 toolkits. So one is a clinical toolkit, and so it offers you a range of prompts and questions and 3 different ways that these films can be used in a kind of healthcare education setting. So with prompt questions, it advises you how to set up a screening that feels safe for staff, or as safe as possible, I should say, and how you can kind of draw different themes out. And so the toolkit is freely available. And then there's also a kind of ethical toolkit, which is for people wanting to run similar projects. So the kind of legacy of the project, beyond the sort of benefit to the 6 people that took part, is this kind of long-term education resource and a method and way of using film in a kind of more equitable way. So outside of this session, absolutely have a look. I mean, I could talk about Life Moving for the whole of this hour, but I have other things that I want to talk to you about. So I'd encourage you to have a look at that and think about how you might be able to use what we did, or adapt or rerun the projects in your own services. The next project I want to talk about is one that some of you will know me in relation to. So No Barriers Here, which is an arts-based, equity-focused approach to advanced care planning with groups and people that are underserved in palliative and end-of-life care. And it's got a particular focus on advanced care planning, or planning for future care. We started this project in the pandemic, and it's been running for the last sort of 5 years. And it's one of the underpinning kind of ideas in it is about disrupting the kind of maternal and paternalism narratives about vulnerable people and communities in relation to conversations about death and dying. It has different parts to it, and I'm going to show you a film in a minute which allows other voices, not just mine, to come through, because one of the key kind of underpinning values of No Barriers Here is that it's based in community engagement, and it's always developed, delivered, and looked after in a space of co-production. It offers less verbal ways to engage in advanced care planning for groups of people that are underserved. There's a facilitated training programme for people to learn how to use the approach, and we also have a healthcare workforce intervention which focuses sort of on developing death and loss literacy. It's, as well as being an intervention, or a variety of interventions, it also has an underpinning research methodology, which I'll talk about a bit later, which is called C-Care. But let me move the slide on and see whether the technology will allow me to show you the film. It's about 10 minutes long, so you can sit back and relax and have a cup of tea if you've got one with you. So No Barriers Here has really been the project where all of these ideas about equity and creativity have kind of come together, where we've been able to test and explore and develop and really think about how we deliver equity orientated work and how we weave sort of 5 key principles together. So the methodology that sort of underpins No Barriers Here is called C-Care, and it's also a methodology that we're beginning to use in other projects. So I'm involved in another project called On Mute, where we're going to use these principles to carry out some work to understand the experiences of people with head and neck cancer, for example. And we're really up for people adopting this methodology. It's an emerging sense. We published a paper about it earlier this year. We really want other researchers to kind of think about it, use it, help it evolve, help it grow, help it develop. But it kind of locates the sort of 5 key principles of No Barriers Here in a framework, and it's come about basically through trial and error and several failures and a lot of sort of humble reflection, I think. But the principles are that we always start with community engagement. So we start by thinking about who are the relationships, what are the relationships we need to have, who are our community partners, who are we not talking to, who isn't represented, who's not here. We lead then into a co-production relationship. So we always work with people right from the start and throughout the project. So our very first group of participants and co-production partners, we're still working with 5 years on. We just published a paper together, a book chapter last year. So that principle of co-production weaves its way throughout all of our work in No Barriers Here. It's absolutely essential that community engagement happens first, and we learnt that by getting it wrong. So the community engagement really underpins the co-production relationship. Relevant to today, art making, arts-based methods are always interwoven, and you can see in the film what the value of that is. You can see how it's allowed voices to be heard differently. It's allowed people to find their voices differently and explore their views. All sorts of different groups and peoples and communities that we've worked with. Inclusive research practice. So the R in CCARE stands for research, but it's about inclusive practice and about disrupting traditional research hierarchies. And then education. So everything that we learn, and one of our participants had this wonderful quote, it's just take. And often research participants from marginalised groups and underserved groups feel like, we tell our stories again and again and again, and whatever happens, what changes, what improves. And so in creating education resources for healthcare professionals, health and social care, for the workforce, for the broader community, for the general public, but also for communities themselves to kind of be empowered about what they can have access to, what they can demand in terms of care, is a really important part. So if you're interested in the methodology side of things, then the reference to the paper is at the end of the presentation, and I'm really up for conversations with people who want to collaborate and think about how we can use this methodology going forward. So I'm really aware of time and of needing to leave space in this hour for some discussion. I just wanted to sort of highlight a little bit what's next, and I think probably my face is covering up this, so I'll also send a set of slides that doesn't have me on it, just the slides themselves. So as I mentioned, we're using the methodology approach in this project on mute. So I'm working with a speech and language therapist and a different hospital trust on that project at the moment. The methodology work is ongoing. So what I haven't talked about much today, and I think it's probably the subject of a separate session, is when we use creative methods in research practice. I think there's a general understanding that we get in more interesting, deeper, richer data, and that the use of creative methods is really important in this sort of dissemination and impact and kind of knowledge mobilization phase. There is a gap which is around methods of analysis, and some of the analysis methods for other qualitative research don't quite cut it. So often what you'll see is, and I've done it, we've all done it, is people make these amazing things and then we interview them and then we analyse the transcript of the interview, which kind of loses some of the inherent visual content. So there's some more methodology work to do, and again, people are interested in collaborating on that. I'd be up for a conversation. We'll be disseminating the latest No Barriers Here study, which focuses on the experiences of LGBT people from diverse ethnic communities, and it's been carried out in a time of real turbulence in the UK and in the world politically around equalities and diversity and understandings of LGBT people's experiences, but also some fairly significant things that happened in the UK around race and race equity. So an interesting study at multiple levels. So that'll be coming out in the coming weeks, and we've worked with a really fantastic illustrator to bring those findings to life. And then on a personal level, sort of for my own work, there's a big piece of work that I'm going to be starting hopefully next year around building kind of death and loss literacy within the mental health system, and hopefully collaborating with some of you on that piece of work along the way. More to come. And then just to summarise, really, I know I could talk about this for a lot longer, but hopefully we can have something of a discussion now with those of you that are live on the call. But I just wanted to summarise some of the key points, really. So sort of takeaways. So remembering that creativity is an innate human experience. It's intrinsically linked to equity, and when used well, it's an incredibly powerful tool in research practice and clinical practice, and it's a great leveller between researchers and participants and patients. And we need less verbal ways for people to take part in research and to access services if we're to even begin to address some of the structural inequities inherent across all of our systems. It's important to remember that you don't need to be an art psychotherapist to do this type of work, but there is an untapped source of collaborative partners there. So you can work with art therapists, you have them around, and some of them have really good research training, and they offer and bring a different lens to this work. So I would really encourage you to kind of find arts therapists that you can collaborate with at the different stages in your research. And I think the thing that I want to end on is just to remember that equity work is activism and creativity is inherent in activism, and that together, we can make real change when we harness the power of creative methods. So thank you for listening to me. I think we're going to hand over now to the chairs of the session for a bit of a discussion. I'm going to move and just leave the final slide up with some links and resources, but I will also send a set of slides around that don't have the recording on. That will be a smaller file size so that you can look at those resources. And I hope I get to see some of you really soon. Thank you.